Alex, your 2-month evaluation data. It is all here. Take a look for yourself. Dead last. This isn't a school. There is no time for you to learn slowly.
Dr. Collins, I know I am a slow learner, so I've been watching every night surgery videos and anatomy diagrams.
What doctor doesn't pull all-nighters? I want results. If you are last again this month, you are out of here.
Ah, that look. So familiar. Thighs.
You've been working for 48 hours straight. Take care of yourself.
I will. I've been working overtime for a month. I have to pass this evaluation.
Failed the evaluation. Don't come in tomorrow.
Why is this happening?
Operator's mental threshold detected. Threshold exceeded. Surgical legend assist AI activated. Reward imaging vision system activating. And surgical guidance.
Whoa. I must be going crazy from overwork. Having cyber hallucinations.
Patient incoming from General Surgery AR. General Surgery ER. We have a patient.
What now? In the middle of the night.
Dr. Collins, male patient, 22. Acute abdominal pain for 3 hours with nausea and vomiting. Patient detected. Activate imaging vision.
This isn't a hallucination. I really have the assist AI activate.
Patient has an abnormal appendiceal torsion. Blood supply cut off. Tissue is necrotizing.
Appendiceal torsion. Ugh. Oh, this is a life-threatening acute abdomen.
What did you eat tonight?
Barbecue.
All right. This is just a mild case of acute gastroenteritis. Start an IV, then some painkillers and antibiotics.
Dr. Collins.
Alex, why are you still here? Didn't I text you to tell you not to come in?
Dr. Collins, his symptoms don't match gastroenteritis. Let's run a full workup on him.
What? You are just a resident. Are you questioning me? You say it is torsion. Where is your proof?
The proof is his life.
This.
Dr. Collins, I am not questioning you. I just think.
Enough. I know you are good with a theory, but in practice, it is all about experience. I say it is gastroenteritis, so that is what it is.
Warning. Patient's tissue necrosis is worsening. It is about to become irreversible.
This is a human life. I can't wait any longer. Dr. Collins, this is life or death. Since you refuse to run further tests, then I am going to see Chief Mason.
Hey, Alex, what do you think you are doing?
Come in. Alex, what brings you here so late?
Chief Mason, the patient from the LDoc. Dr. Collins diagnosed him with gastroenteritis. But I strongly suspect it is a clinical case of the extremely rare appendiceal torsion. He needs emergency surgery now.
Alex, you are a failed resident. What gives you the right to grandstand here? What if you are wrong? Can you take responsibility for that?
Alex, you do realize the probability of appendiceal torsion. It is 1 in hundreds of thousands.
Chief Mason, according to the Williams surgical textbook, the early stages of appendiceal torsion are easily confused with acute gastroenteritis, and the pain progresses very rapidly. If we treat it as gastroenteritis and delay treatment, then the result will be intestinal necrosis and septic shock.
Anyone can quote a textbook. Clinical practice is about experience, not just theory. You say it is torsion. Where is your proof?
The proof is the patient's life.
Alex is right. We can't take that risk. We can't afford to. Hello. Get ultrasound here for an emergency consult. General surgery. Now.
Chief! For residents' wild speculation. You are waking up the on-call doctor in the middle of the night. This is against protocol.
Protocol. Protocol or a life. Which is more important?
Chief Mason, what is the emergency?
Check the right lower quadrant. Focus on the appendix's blood flow.
It is just a simple case of gastroenteritis. Making such a big fuss in the middle of the night. Let's see how you get out of this.
Swollen appendix. No blood flow detected. It is appendiceal torsion.
How is that possible?
If I forcefully separate the adhesions, I'll tear the healthy intestinal wall. He'll die for sure. Alert all. Prep for a laparoscopic exploration. Stat, now!
Yes, sir.
For this surgery, I'll be the lead. Alex, you are first assist. Henry, you are second.
Chief, a resident has first assist, and I am second.
What? You have a problem.
Number, no problem.
If I can just get through this surgery, I might have a chance to stay.
Chief, the patient is under anesthesia.
It is her.
Begin the surgery. Oh, no. The patient's appendix is completely necrotic, and the surrounding omentum and small intestine are severely adhesed. Gangrenous perforation. He has localized peritonitis. We can't wait any longer. Ultrasonic scalpel.
Chief, what are you waiting for? Let's get the surgery started.
The necrotic bowel is too fragile. If we force the adhesions apart, we'll tear the healthy bowel wall, causing fecal spillage. If that happens, the patient will die for sure.
Then, what do we do?
Time is running out. If we wait any longer, the patient will still die. What should I do?
High penalty surgery detected. High penalty surgery detected. Scene surgical. System activate. Seeing severe adhesions. Severe adhesions. Activate surgical guidance.
Activate.
This line is between the necrotic appendix and the fragile bowel wall. If I cut along this line, I won't damage the healthy bowel wall. Chief, we can start at the terminal ileum, at the mesenteric fold. There is a safe gap there.
Alex, are you kidding? That spot has terrible visibility. It is a terrible angle. That is a no-go zone for standard procedures. What if something goes wrong?
Besides my way, do you have a better idea?
Chief, we're running out of time. Just try Alex's idea. I trust him. He wouldn't joke about a patient's life.
She really trusts me. That look. Have I seen her somewhere before?
All right. No other choice. Alex, you try.
Chief, are you kidding? He is just a resident. Letting him lead. That is insane.
Enough. That is final. I'll take full responsibility.
The chief trusts me. I can't let him down.
Huh. Impossible. All that necrotic tissue. He stripped it all away.
Dissecting forceps. I may not have any real surgical experience, but if I just follow this guideline, I can precisely remove the necrotic appendix. Come on, Alex. Time for your first surgery.
Just a resident. He is clumsy even with sutures. A surgery this hard. If he can pull this off, I'll eat my hat. Impossible. All the necrotic tissue, he stripped it all away.
Not only that, Alex also perfectly avoided all the delicate intestinal blood vessels. This dissection technique, it is nothing short of divine.
Chief, if you had done it, could you have pulled it off?
If it were me, in a lifetime, I could never be that precise.
Just a resident. How could he be this skilled? Has he been holding back all this time?
Surgery complete.
Well done. Our Central City Medical Center has finally found a true genius. Alex, we're so lucky to have you. Our hospital was saved from a malpractice suit. You didn't just save the patient, you saved Dr. Collins, too.
Alex, I am sorry. I was so wrong. I almost killed the patient. Without you, my career would be over.
It is all right, Dr. Collins. As long as the patient's safe. Chief Mason, can I ask you for a favor?
Of course. You are the hero today. Go ahead. If it is within my power, I'll grant it.
My lifelong dream is to be a doctor who saves lives. Can I please stay at the hospital?
Henry, what is going on?
Chief, here is the thing. Alex. Oh, Alex. He failed his 3-month evaluation.
so I fired him. Ridiculous. A talent like him should be nurtured. How could you fire him?
Yes, it was my mistake.
Alex. Don't worry, you can stay on, and I'll ask the director to make you a full-time staffer early.
Thanks, Chief Mesa.
It is nothing.
It is 3 a.m. Let's get some rest. Anything else, we'll talk tomorrow.
Alex.
Congrats, operator. Completed ultra-high difficulty. AR surgery. Reward. Surgical simulation suite.
This is my bed. You can sleep here tonight.
Maybe I should just go home.
You haven't slept in 2 days. In your condition, can you even get home safely?
But if I sleep here, where will you sleep?
We can just squeeze in.
You want to sleep with me?
For a special case, I don't mind.
But
I don't mind. You are a grown man. Why are you being so shy?
alright. You win.
Give me your clothes.
Thanks.
Sleep.
Let me help you sit down. What is wrong? Should I get a doctor to check on you?
No, it is just low blood sugar.
I have a couple of candies. Here, eat them. You'll feel better.
Thanks.
It's nothing. If you're okay, I'll get going. I have to go change a patient's dressing.
So sweet. Oh, a resident pulled off a surgery. Even Chief Mason couldn't. How on earth did he do it? Is this what a genius is?
Congratulations, operator. Congratulations, operator. You completed ultra-high difficult emergency surgery. Difficult emergency surgery. System activated. Mission reward. Reward. Surgical simulation suite. Operator can use the simulation suite. Operator can use the simulation suite. System activated. For unlimited surgical simulations. For unlimited surgical simulations.
System. Activate the surgical simulation suite.
Welcome, operator, to the surgical simulation suite. Current time ratio 10 to 1. Welcome, operator, to the surgical simulation suite. Current time ratio is 10 to 1. System activated. 10 to 1. Operator. Operator can use this space to simulate any surgery.
Amazing. With this simulation suite, my surgical skills will advance by leaps and bounds. Plus, with the Assist AI's advantages, from now on, no matter the condition, I can handle it all. System. Start the surgical simulation. It is not what it looks like. I was just trying to get my hand out. Oh, no. My hand's numb.
Ha! Emily! I brought you breakfast. What are you two doing? Stanton! How dare you do this to Emily? You are a...
Enough. If you are done, please leave.
What are you two doing?
Oh, it is Dr. Carter. You are here early.
Stanton! How dare you do this to Emily? You are a monster! Emily, did this guy force you? I am calling the cops to arrest this animal.
He didn't force me. He kissed me by accident.
Emily, this loser. How could it have been an accident? He was definitely up to something. Emily, listen to me. Call the cops now. Get him arrested. Teach him a lesson.
I know better than you if it was an accident. Besides, we're not that close, so don't call me Emily.
She is defending me.
And this is the break room. You barged in without knocking. Is that how you were raised?
Emily, I didn't mean to barge in.
Enough. If you have nothing else, please leave.
Stanton, you just wait.
So now, I have an enemy for no reason.
With your skills, he is not even qualified to be your enemy.
Alex, are you up? Get to the conference room for a meeting.
A meeting? Chief.
Now that everyone's here, I'll get straight to the point. Just now, a patient was brought in from the ER. He has a complex inguinal hernia. He needs surgery. Stat.
Oh, a complex hernia. That is an extremely difficult procedure. To complete a surgery like this, it'll take at least 3 or 4 hours.
I just simulated this last night in the simulation suite. A complex hernia resection. Too bad there are so many senior doctors here today. I probably won't get to be the lead surgeon.
I am going to give a new resident a chance. This surgery, let a resident try.
Chief, let me do it.
Brian has a solid theoretical foundation, and he has plenty of clinical experience. Among this batch of residents, he is the best. Letting him lead is a solid choice.
The deputy chief is right. Let Brian lead.
I agree.
Stanton, we're both residents. This is the difference between you and me. Once Emily sees how great I am, she'll definitely choose me.
All right. I've decided. This surgery will be led by Dr. Stanton. Dr. Carter, you'll be the second assistant. Learn from Dr. Stanton.
Yes. You'd better hope you don't make a single mistake, or else I'll make you pay. What? Alex Stanton as lead surgeon?
Did the chief have one too many last night? Alex Stanton as lead surgeon. Alex Stanton is the worst resident in our class. Letting him lead, isn't that playing with a patient's life?
Right. Chief, did you get the name wrong?
Right, Chief. I am Brian Carter. I am not Alex Stanton.
I didn't get the name wrong. Alex Stanton, you are the lead surgeon. Any problem?
No problem. Chief.
Chief, Alex can't even suture a wound without fumbling. A surgery this complex. How could he possibly handle it?
He is right, Chief. This is a life or death situation. We can't be reckless.
Sit! Alex, sit! I forgot to tell you all. Just last night, Alex led a successful twisted appendix surgery.
A twisted appendix.
That loser, Alex, how is that possible?
What? You think I am lying to you?
Of course not.
So that means Alex is even better than Brian. So for him to lead today's surgery, he is a better fit than Brian.
Good. Alex Stanton is the lead surgeon. Henry, you are his first assistant. Brian, you are second assistant. Learn from Alex.
Yes. I heard. Chief Mason was there last night. You only succeeded with that twisted appendix because you had Chief Mason's help. Don't mistake luck for skill.
Brian, watch your mouth.
Alex, we'll see if it was luck soon enough. And I hope you don't hold us back, Dr. Carter.
You'd better hope you don't make a single mistake. Or else, I'll make sure your career as a lead surgeon is over.
Are you done? Then let's get back to the surgery.
Alex, let's see how long you can stay so cocky.
Surgical scenario detected. Complex indirect inguinal hernia, tension-free repair. Activate surgical guidance.
Activate. With the Assist AI's cheat code, plus last night's training in the simulation suite, today's surgery for me is a piece of cake. Scalpel.
Alex, let's see what you've got. What? How is that possible?
Code Red. ER has a patient with multiple trauma from a car crash. Preliminary diagnosis. Splenic rupture.
Splenic rupture? That is life! Threatening!
That cut was so precise. He cut through the adhesions. Alex, a bottom-ranked resident. When did he get so good?
Huh, Brian. Now you see how good Alex is. So show him some respect.
Use your head. If Chief Mason chose Alex to lead, he must trust his abilities. You don't think Chief Mason would gamble with a patient's life, do you?
Alex is full of surprises. His technique is so clean. Not a wasted movement, and not a moment of hesitation. It has only been half an hour, and he is already suturing.
John, if you were leading this, how long do you think it would take you?
At least an hour, minimum. This kid, he is more than twice as fast as me. Chief, we've really struck gold with him.
Chief, it is urgent. We have a patient. He has pancreatic cancer. He needs an emergency pancreatic conjuncectomy.
This is a complex surgery. I'll lead it. You stay and handle things here.
He finished the whole surgery in under half an hour. Even the chief would take almost an hour. Alex, you are amazing. When are you going to teach me a few tricks?
He just got lucky. This patient was stable. Next time he gets a critical patient, he'll be exposed.
Luck is part of skill.
Exactly. You keep saying Alex just got lucky. Then why aren't you so lucky? Is it that you don't want to, or you can't?
If I got a chance to lead a surgery, I'd do a much better job than him.
Red, alert.
Red alert. ER has admitted a patient with multiple trauma from a car crash. Initial diagnosis, splenic rupture, massive intra-abdominal bleeding, and hemorrhagic shock. General surgery. Please respond immediately to the ER trauma room.
Splenic rupture! That is life-threatening!
Let's go.
We can't rush into this. It is too risky. The vasculature is too complex. If we damage the pancreatic tail, the consequences are unthinkable.
If you won't lead, I will.
General surgery's here.
Henry, you are finally here. He is crashing.
What is the situation?
Splenic injury. Major vessel bleeding. Heart rates dropping.
Patient detected. Activate imaging vision.
Activate.
Warning. True splenic rupture. Splenic Hiller vessel tear. Active massive hemorrhage.
Splenic Hiller tear. That is like the main water valve, exploding if we don't act fast. In less than 10 minutes, he'll bleed out and die.
He is bleeding too much. At this rate, he won't last 10 minutes. Alex! Brian! Any ideas?
With bleeding this heavy, only the chief can handle this. Where is the chief? Why isn't he here?
The chief is in another surgery. He can't make it.
Then, what do we do?
With bleeding this heavy, laparoscopy won't stop it. We have to open him up now.
Then open him up! Chief, he is crashing!
I've never done this before. Major trauma surgery. What if I open him up and can't stop the bleeding, and he dies on the table? My career will be over. Can we get him a contrast CT first, to pinpoint the exact location of the bleed?
He is in shock. His vitals are almost gone. How can we possibly get him to a CT? Just operate!
No, opening him up now is too risky. The vessels are so complex. What if I damage the tail of the pancreas? The consequences would be unthinkable.
Chief Parker, we can't wait. We have to open him up now to stop the bleeding.
Alex, I want to, but this is a splenic Hiller tear. This isn't a simple appendectomy.
Alex, you are just a resident, so stop interfering. If you influence Chief Parker's judgment, can you handle the consequences?
Chief Parker, he has hemoperitoneum. Over 2,000 ml. His BP is dropping. It is classic. Late-stage hemorrhagic shock. We have a 3-minute golden window to clamp the splenic pedicle. Otherwise, even a miracle worker can't save him.
You make it sound so easy. Once we open him up, how do we quickly control the bleeding? What if the splenic hilum is anomalous? What if I damage the pancreatic tail?
Chief Parker, there is no such thing as a sure thing in trauma. We have to act now. Emily, tell the OR. Prep for an exploratory laparotomy.
On it!
Alex, how dare you give orders? Chief Parker!
Since you won't operate, I will.
Alex, you are scrubbing in with me!
Alex, he is in VFib. I don't believe you can save him.
If you won't do it, I will.
Alex, do you have any idea what you are saying? This is a splenic rupture. It is not as simple as an appendectomy.
Alex, stand down! You don't get to call the shots here! Alex!
A surgery this complex. Even if the chief were here himself, he wouldn't be sure. Don't be a hero.
In the surgical simulation suite, I've performed this surgery hundreds of times. An open splenic rupture surgery. Though this surgery is very difficult, with the assist AI's help, I am absolutely confident I can do this.
We have to stabilize his blood pressure. Blood transfusion. Now!
Chief Parker, the patient has a splenicular artery rupture. Just a transfusion. Can't keep up with the bleeding. We have to open him up now. Clamp the splenic pedicle to stop the bleeding.
How did you figure that out?
Chief, there's no time to discuss this. We have to get him to the OR now. Otherwise, it'll be too late.
All right, let's get him to surgery. I'll lead.
I want to be your first assistant.
You? First assistant? The splenic hilum is a complete mess. Can you even tell the artery from the vein?
I can. And I can help you find the bleed in 30 seconds.
Find the bleed in 30 seconds. Do you think you are playing a surgery simulation game? Or do you have X-ray vision?
Oh no! He is in B-fib! He is crashing!
It is over. He is going to die on my watch.
Chief Parker, it is not over yet. Are you just going to give up?
How can he be so calm? All right, let's go. To the OR. Now, Alex, you are with me.
Alex, he is in V-fib. I don't believe you can save him.
Chief Parker, we can do this. Ready to open.
Oh no! Massive bleeding!
I can't see anything. I can't see the splenic hilum at all.
Oh no! Massive bleeding!
Quick! The suction! No good. It is an arterial bleed. The suction can't keep up with the bleeding. It is all blood. There is no surgical field. I can't see the splenic hilum at all.
Can't see the hilum. Can't find the bleed. In this situation, there is nowhere to cut. We can't proceed.
If this continues, in less than 3 minutes, he'll bleed out. Chief Parker, you have to do something.
What do I do? What am I supposed to do?
System active. Surgical guidance. I've located the main splenic artery. Give me the forceps.
Alex, what are you doing? Don't be reckless.
Chief Parker, I told you. I'd find the bleed in 30 seconds now. Watch this.
I am not fit to lead this surgery anymore. You take over.
Okay.
Your secrets just keep piling up.
He stopped the bleeding.
His forceps have eyes. No visibility, and he's still clamped to the splenic artery.
Chief Mason had a similar case last time. He spent 10 minutes just on the bleeding.
It is like he has a god's eye view. It is incredible.
Alex, your secrets, they just keep piling up.
Alex, how on earth did you do that?
Chief, the surgery isn't over. We've only stopped the bleeding. But we still need to remove the damaged spleen.
All right, let's continue. Damn it! My hands won't listen.
Don't worry. I am here.
One cut! Just one cut! And he precisely removed the damaged spleen. Alex, what kind of monster are you?
Chief Parker, the battle isn't over. Let's continue the surgery.
I am not fit to lead the surgery anymore. You take over.
Okay. All right, I'll take over.
Look at Chief Parker. The surgery must have failed. Alex, if you hadn't insisted. On an open surgery, this surgery wouldn't have failed, and the patient wouldn't have died. This medical malpractice is all your fault.
Who told you the surgery failed? This splenectomy was successfully led by Alex.
What? Alex led it?
What are you implying? That I am lying to you?
The lead surgeon for this splenectomy was Alex. He is just a bottom-rung resident. He is so clumsy, he can't even do a simple injection. How could he possibly perform a surgery of this caliber?
So you are saying you think I am lying?
Chief Parker, that is not what I meant. I just think, no matter how talented someone is, they can't, in just a couple of days, completely transform. Alex, you owe us an explanation.
My assist AI, I can't let anyone find out. But if I don't give them a good explanation, Brian won't let this go.
Why should he explain himself to you? As doctors, as long as we save lives, that is all that matters. How he did it has nothing to do with you, me, or anyone else.
Damn you, Alex. You dare steal my girl. I'll make you pay for this.
John, what is going on? I just got out of surgery. When I heard the hospital's red alert, they said a patient with a massive splenic hemorrhage.
Chief, it is handled.
You are the lead surgeon.
Chief Mason, you might not know. The lead surgeon for that splenectomy was Alex. According to hospital rules, a resident isn't qualified to perform a surgery of this caliber. If caught, it is permanent expulsion. To save himself, John will surely pin all the blame on Alex. Alex, you are finished.
John Parker, is what Brian Carter said true?
This is bad. Letting a resident lead a red-level surgery. Deputy Chief Parker, he'll probably get demoted to the clinic. Chief Parker blames it all on that resident, saying he acted on his own and overstepped, then he might get off scot-free. But then, that resident's career will be ruined.
To save himself, John Parker will definitely pin all the blame on Alex Denton. Alex, you are finished.
At a time like this, he is still so calm.
Chief Parker! It is not over yet. Are you just going to give up? Chief Parker, we can finish this surgery.
Sorry, Chief. It was my fault.
Damn John Parker. Has he lost his mind? A deputy chief, admitting he is incompetent.
The record. As a deputy chief, you panicked in the OR and nearly caused a major medical incident. Write a 10,000-word self-criticism and a hospital-wide notice.
Yes, Chief.
Chief Mason, even if Chief Parker made a mistake, a mere resident leading a splenectomy, this is a serious violation of hospital protocol. He is playing with the patient's life. If the higher-ups investigate, the whole department will be punished. Alex Stanton must be punished.
Yeah, after all, Alex is just a resident. We can't let him jeopardize the whole department.
Brian Carter, answer me this. Rules or a patient's life? Which would you choose?
I only did it with the assist AI. That is how I finished the surgery. How am I supposed to write that?
Third time. I am looking at the details.
While following the rules.
Do our best.
No conditions. You have to choose one. We're doctors, not lawyers. The operating table is our battlefield, not a conference room, for debating rules. Without Dr. Stanton in today's surgery, the patient probably wouldn't have made it. Whatever method he used, whether it was by the book or not, he saved a life. That is the only rule that matters. As for responsibility, I'll take it if the hospital investigates. Tell them I, Gregory Mason, authorized it. Any more questions?
No.
Alex.
Yes.
You did well. But it is not enough to just be good at surgery. You have to explain and document it. You are rewriting the surgical record tomorrow. Include all the reasoning and thought process. And every single detail.
My assist AI is my cheat code. That is how I pulled off the surgery. How am I supposed to write that?
It is due at 8 a.m. tomorrow. Any questions?
No problem.
Alex, you just wait.
Chief Mason, here is the surgical record.
This record seems fine on the surface, but between the lines, it feels like he is hiding something.
That old fox, Chief Mason. He didn't figure it out,
did he?
The video of your surgery. I watched it 3 times. The first time, I watched the result. The patient survived. You did well. The second time, I watched the process. Your technique was flawless. The third time, I watched the details. Alex, tell me, how did you find the bleeding point? In one clap.
What do you mean, Chief?
That resident, Alex Denton, he is getting a permanent spot early.
Heard Chief Mason put in the request himself.
Chief Mason, according to Care's surgical manual, 12th edition, regarding the anatomy of the splenic hilum.
Don't just recite the textbook. I just want to know, with no clear surgical field, how did you find the bleeding point?
If I tell him about the assist AI, he'll either send me to psychiatry or have me sliced up for research.
Fine. Don't tell me. Have a seat. Your current skill level is already far beyond most of our attending physicians. To have you just changing dressings and writing charts, it is a waste of talent.
Chief Mason, you mean...
I've decided. I'll personally report to the Medical Administration Board to make you a full-time doctor early, and I am giving you the right to perform all Level 2 surgeries alone, and some Level 3 surgeries.
I've finally become a real doctor. Thank you, Chief Mason.
Just use your skills well, and put our general surgery department on the map. As for the rules and procedures, I'll handle it. I'll take the fall.
That resident, Alex Denton, is being kept on early.
Heard Chief Mason personally put in the request. He is on the special talent track.
Off this resident class, Brian Carter is pretty good too. I thought he'd get the spot. Never thought it'd go to Alex. What a shame.
A guy who can't even suture straight. A loser. First, he stole my girl. Then my surgery. Now, he is even stealing my spot here. Alex, you've gone too far. Then you asked for it. ER surgery is about luck and guts, but our daily clinical work is about the fundamentals built over time.
Dr. Carter, I'll return the favor. Perfect. I have a question for you.
Congratulations, operator. You've completed a difficult splenectomy. Reward. Unlocked function. You can now search all medical knowledge and literature.
Doesn't that mean I have a portable medical library? Anytime I need to look something up, I can just have the assist AI do it for me.
The chief is in a meeting, so I'll be running today's morning conference. About the emergency splenectomy the other day, I am sure you've all heard about it. Alex handled it decisively. That deserves praise. But emergency surgery is about luck and guts. But our daily clinical work is about the fundamentals we've built up over time. We can't let one lucky success make us overlook the importance of theory.
Dr. Carter is up to no good.
Yeah, in a few words, he just dismissed Alex's great work as just luck and guts.
This is going to be good.
Alex, you handled a splenectomy, a surgery this difficult, so easily. So, I ask you a very basic question. You can answer it, right?
Go on.
Please explain. The caudal pancreatic artery's anatomical variations, the risk of injury for each type during surgery, and the management plan.
Wow, that is a really tough question.
Yeah, it is such an obscure topic. We almost never use it. Even for us attending physicians, we might not be able to answer it, let alone a resident.
Alex, in front of everyone, I am going to prove you are a complete loser.
Before, I really wouldn't have been able to answer that. But now, assist AI. Search for caudal pancreatic artery variations.
Searching. Search complete.
Alex, you are a bottom-ranked resident. It is normal. You can't answer.
Who says I can't answer? The tail of the pancreas is mainly supplied by branches of the splenic artery. According to the latest Cara surgical manual,
Is Alex right?
Hard to say. Dr. Carter, how was my answer? Well,
The sources and data Alex cited. It is word for word from the original. Is he even human?
Dr. Carter, turnabout is fair play. Perfect. I have a question for you.
I'll handle this for you.
Really? Dr. Wade, I'll be waiting to hear good news.
Dr. Carter is petty. He won't let this go.
Go on.
Suppose you are in the middle of surgery. While dissecting the splenic hilum, a retrograde branch from the left gastric artery ruptures and starts bleeding. Blood pressure drops from 120 to 90 instantly, and it is still dropping. As the lead surgeon, do you clamp it with a hemostat? Or suture it directly?
In that case, the first thing to do is stabilize the patient's hemodynamics. Then,
blood pressure's already dropped. Heart rate spiked to 130. No time to stabilize. Clamp or suture. Stop spouting textbook answers. You are weak. Practice more.
don't get cocky. Stanton, you'd better hope you don't make a single mistake. I'll be watching you.
Fine. Then keep a close eye. Don't lose me.
Dr. Wade, it is me, Brian. Right. I am doing well in Central City. The staff here have been really good to me, but there has been a problem lately. There is this guy, Alex Stanton. He stole my spot here.
All right, leave it to me. I'll take care of this for you.
Really, Dr. Wade? Then I'll wait for good news. Stanton! That spot is mine. Trash like you is meant to be crushed under my feet.
I heard about the meeting yesterday. Brian's a petty guy. He won't let this go. Be careful.
I will. Let's go to the next one.
Wait.
But a resident, that is against protocol.
I will use my own hands to save patients' lives.
Look, you've got gray hairs. Get more rest. Your health is most important.
Okay. You got it. Let's go.
This city-level trauma center evaluation is crucial for your hospital and for Central City's entire medical layout. It is extremely important. There can be no mistakes.
Yes, we will, sir. We'll do our absolute best.
The one in the white coat is our hospital director. The one next to him must be a department head.
Let's go to the next room.
All right. Gregory Mason submitted a report to me for a special talent. I saw it. Gregory's always eager to find talent. I can understand. But making an exception for a resident, that is against protocol.
Sir, so you mean?
This Alex Stanton is getting too much attention. Let's put him in his place.
He probably doesn't know how good you are. He thinks making an exception for a resident is against protocol. But I believe, once he sees your true skills, he'll regret this decision.
Don't worry, I am fine. Even if I am just a resident, I'll still use my hands to save lives. Let's go. Back to rounds.
Despite the injustice, he is so calm about it. I believe your stage in the future will be the whole world.
It is okay, Chief Mason. I may not be a full doctor, but at least...
Time to call it.
Chief Mason, wait.
Come in.
Chief Mason, you wanted to see me.
Have a seat.
It is about your early promotion. I've already submitted the report. But it was rejected by the board. Sorry, I couldn't keep my promise.
It is all right, Chief Mason. Even if I can't be promoted, at least I can still save lives. That is enough.
Good. Don't worry. I'll find a way to get you promoted early. Oh, right. There is a consult in gastroenterology. Come with me. It'll be a good learning experience.
Okay.
Thanks for coming, Chief Mason.
What is the patient's condition?
He has late-stage stomach cancer. The tumor has metastasized. Surgery is no longer an option. The family still hasn't given up, but they wanted you to take a look, to see if there is any chance.
Sorry. It is too late. Even if we open him up now, we can only do palliative surgery. As for extending his life, it is pointless now.
Assist the eye. Activate imaging vision.
Foreign calcified egg structure model matching in progress. Match found. Highly suspected parasitic granuloma.
A patient the entire hospital's experts diagnosed with late-stage stomach cancer. It is just a parasite. If treated for cancer, it'll only speed up his death.
Go tell the family. It is time to give up.
Chief Mason, wait.
What if you are wrong? Do you know what is at stake? Here is the latest report. Take a look.
Chief Mason, wait a second. Chief, I think this diagnosis might be up for debate.
Dr. Stanton, our gastroenterology and imaging departments and pathology have all confirmed this. You are just a resident. Are you questioning our expertise?
Chief, I've already reviewed this case. The patient's imaging is textbook, but his tumor marker levels are disproportionately low. I suspect this could be a parasitic granuloma.
A parasitic granuloma? What is your basis?
The basis is the disproportionately low tumor markers. I am requesting a use-guided deep biopsy. Focus on eosinophilic infiltration and look for evidence of a parasitic infection.
Just because of one abnormal marker, Dr. Stanton, we treat patients, not play detective. Pathology has confirmed it. Are you questioning all of our expertise?
Do as Alex says. Schedule the use now. All costs will be on general surgery.
Yes.
Alex, what if you were wrong? Do you know what the consequences will be?
I know. I'll not only lose my chance to be promoted, I could even be fired. But I will never give up any chance to save this patient.
I hope you are right. Here is the latest report. Take a look.
Chief Mason, the patient's tumor marker levels don't match what you'd expect for advanced linitis plastica. It is a complete mismatch. I don't accept this report.
Alex! Do you have any idea what challenging? You are not just challenging a report. You are challenging the entire authority of this hospital.
You really think you are that good? To challenge the gold standard?
If you are wrong, your career is over. This diagnosis was made by Dr. Grant from gastroenterology, Chief Collins from radiology, and several senior staff from our department. It is the result of a joint consultation. It is the gold standard.
The gold standard can be wrong. According to The Lancet, a review published last year states that parasitic granulomas on imaging are over 90% similar to linitis plastica. And the patient,
he's better. What you are saying? Do you think the panel didn't consider that? The odds are just too low.
Low odds don't mean zero. Chief, if we're wrong, and we put him on chemo, we'll just be using a highly toxic drug to attack an enemy that doesn't exist. That is not treatment. That is murder.
Call the admin office. Tomorrow at 9 a.m. Organize a hospital-wide conference for this case. Yes. Gastroenterology. Bed 12. Oh. I am giving you this chance, but know this. In front of all the hospital's experts, you are trying to overrule the gold standard. If you are wrong, your medical career is over. Are you sure? Have you thought this through?
I am sure. Chief.
Hey, did you hear? That resident Alex Stanton from General Surgery. He is crazy. He is actually challenging Dr. Grant's diagnosis of stomach cancer. Says it is parasites. He has no idea what he is doing. He is just a resident. And he dares to question our hospital's experts.
Just wait. At tomorrow's conference, it is going to be a show.
Alex. You just got lucky with a few surgeries. You really think you are that good to challenge the gold standard?
Then Emily will see that she has fallen for a total loser.
Tomorrow's conference. Go out there and shut them up.
The gold standard. Can't it be questioned?
The gold standard can be questioned. But not just any nobody can question it. At least, you don't have the right.
Chief Mason called himself to hold this hospital-wide conference for Alex. Even Chief Mason thinks Alex has the right to question it. Who are you to say he doesn't?
Emily, what is so great about Alex? Why do you always take his side?
Taller and better looking. Is that a good enough reason?
So what if he is taller and better looking? But I am richer than him. Sports cars, designer bags, a villa. I can buy you anything you want.
Sorry, but I am shallow. An ugly guy like you. Get lost.
Alex, I dare you to disprove the gold standard. At tomorrow's conference, I'll be there to watch you make a fool of yourself. Then Emily will realize that she has fallen for a complete loser.
What you just said.
I was just messing with Brian. You didn't actually believe me, did you?
Beautiful women are the best liars.
Just kidding. Actually, what I said was all true. You, Alex, others may not believe you, but I do. From the day you started here, you've worked tirelessly for your patients. Never slacking off. I know you'd never joke about a patient's condition. So, at tomorrow's conference, go out there and shut them all down.
How can you use a near-zero probability to disprove a confirmed diagnosis?
It is good for a young doctor to have ideas, but you can't be so unrealistic.
All right, let's begin.
This patient is the case we're discussing today. After a multi-specialty consultation, our preliminary diagnosis is advanced gastric cancer. But there is one inconsistency. The patient's tumor marker levels don't match what we'd expect for someone with advanced cancer. Because of this, I believe this case is very much worth further discussion.
Dr. Stanton, we've already considered all the points you've raised. But the odds are 1 in 10,000. How can you use a probability that is practically zero to override a confirmed diagnosis? Dr. Alex, medicine isn't a detective novel. We can't base a diagnosis on a hunch. The CT shows a rigid stomach wall and diffuse thickening. That is ironclad proof of advanced gastric cancer.
It is good to have ideas, young man, but you can't be so unrealistic.
Yeah, this is just a complete waste of all our valuable time.
But if we don't do a deep biopsy, we'll never—
Enough!
Alex, today, I'll step on your head and crush you. Alex, are you even fit to be a doctor? Do you know why your staff position was denied? Stanton, who do you think you are? With a little dumb luck and some textbook knowledge, you dare grandstand here and challenge the authority of this entire hospital.
Yeah. Wanna?
Stanton, you don't even care if the patient lives or dies. You just want to show off. Climbing over your seniors to get ahead. Using a terminal patient's last days to pave your own way. Stanton, are you even fit to be a doctor?
Right. Just a resident. He just got lucky. He did a few surgeries and now he thinks he is all that. Since this hospital was founded, our gold standard diagnosis has never been wrong. A resident dares to challenge our authority. He is not worthy.
Right. Someone who grandstands and doesn't care if the patient lives or dies is a disgrace. He should be fired to set an example.
It is logically sound, but lacks key evidence.
Enough. The discussion is over. Medicine is a rigorous science. Based on the current evidence, I declare the original diagnosis stands.
Let's go. Let's go.
Chief, what did you think of today's case?
Dr. Alex's idea was too bold. Medicine is about evidence. Endoscopy, CT, medical records. All the evidence points to stomach cancer.
I agree with the diagnosis. But Dr. Stanton, he found a clue that everyone else missed and saw the impossible. That is a unique clinical mind. At least, he shouldn't be dismissed outright or called a grandstander.
I wish you were right, but let's go.
Stanton, look at you now. You look like a dog. You know why your spot on staff was taken away.
You were never worthy of being my rival.
Brian!
It was you? Sis.
One phone call, and I got your spot revoked. That is the class difference between us. You against me.
I never wanted to fight you. Because you've never been worthy of being my rival.
You, Brian! What are you doing?
Alex, are you okay?
I am fine.
Emily, don't you get it? This guy is just a show-off and a loser. He pulled off a few surgeries. Just by luck. Don't be fooled by him.
I know better than you if it was luck. You have no right to judge him.
Alex, today, in front of the whole hospital, you made a fool of yourself. Chief Mason won't help you now. You are about to get fired.
That is none of your concern. If you have so much free time, why not? Spend it improving your own skills. Stop being all talk. Emily, let's go.
Dr. Stanton, a moment.
Mr. Grant, what is it?
The hospital has its rules. As a resident, you must respect your superior's diagnosis. We don't want to hear about a doctor privately telling a patient's family misinformation and disrupting the treatment process. Understood.
What if the rules are wrong?
Stanton, watch your tone. Central City Medical Center is not the place for your heroics. Drop those unrealistic ideas. Understand.
What if the rules are wrong?
Stanton, watch your attitude. Central City Medical Center is not the place for your heroics. Drop those unrealistic ideas, or else your residency evaluation will be terrible.
Alex, what is your plan now?
I am sticking to my judgment. Until the very end, I will never give up.
No matter what you do, I'll support you.
Do you really trust me that much?
It is not that I trust you. It is, I hope you are right. That way, that patient can survive.
He will survive. He will. Since I can't reveal the assist AI, I'll have to use existing literature to find a breakthrough. Assist AI search for all literature and data on parasitic granuloma.
Save successful. Total results.
With all this literature and data, I can find a breakthrough and challenge the so-called gold standard. Here, I have 2 candies. Go on, eat them. You'll feel better.
Alex, against absolute authority, all your struggles are just a joke.
You're awake.
Wait, you just...
I didn't do anything. You didn't see anything, right? Don't forget to eat.
Here, I have 2 candies. Go on, eat them. You'll feel better. It was her. I've gone through all the data and organized it. Theoretically, there is no solid evidence. Unless we run a deeper scan. But...
Alex, against absolute authority, all your struggles are just a joke.
Are you Dr. Stanton?
And you are?
Dr. Stanton, I am the son of the patient you discussed at yesterday's conference. Is there still hope for my dad?
Alex, at yesterday's conference, weren't you so sure it wasn't cancer? So why now? Are you hesitating?
My dad, is there still hope for him?
Dr. Stanton, you said at the conference that my dad might not have cancer. Is that true?
This is a hospital. We have rules here. As a resident, you must respect your superior's diagnosis. We don't want to hear about a doctor privately telling a patient's family misinformation and disrupting the treatment process. Understand?
Dr. Stanton, we trust you.
Dr. Stanton, please, save my father. If it is really cancer, we'll accept it. But what if it is not? We can't let my father just wait to die without knowing why.
Dr. Stanton, this is a liability waiver. We're volunteering for an exploratory surgery. No matter the outcome, all consequences are on us. It is not on you or the hospital.
Alex, at yesterday's conference, weren't you so sure it wasn't cancer? So why now? Are you hesitating? Don't tell me. You were just using a patient's life to make a name for yourself.
Sorry. The chief has to approve the surgery.
Well...
Alex! Just now, I performed a deep biopsy myself, but we still couldn't get definitive proof. The pathology report still points to stomach cancer.
Dad, is there really no hope?
But in the tissue fluid, the eosinophil count is abnormally high.
Eosinophils! That is the classic sign of a parasitic infection. Alex, you were right.
Is Gregory Mason insane? Letting a resident challenge the entire hospital's authority?
Director, the family was very insistent. Also, Chief Mason signed off on it.
Impossible. He's just a resident. He can't possibly overturn the gold standard.
Even if there is an abnormal elevation, that is not enough for a diagnosis. Unless we do an exploratory laparotomy and find evidence of the parasite.
Let's open him up.
This exploratory surgery is extremely risky. If we open him up and find widespread late-stage cancer, there is nothing we can do. The patient might not even make it off the table.
Even if there is a slim chance, we won't give up.
Dr. Stanton, Chief Parker, please.
The hospital's triple board consultation set the gold standard diagnosis. It can't be overturned. So if they open him up, he is a dead man. With a medical disaster this big, Alex Stanton, you are finished.
Alex, here is the surgery request. I've signed it, but think it through. If we open him up and you are wrong, no one can save you and your career, as of today, is over. As for me, your mentor, approving this reckless surgery, I'll also have to take full responsibility. My chief position is over. So if you've thought it through, submit the surgery request.
I am not wrong, Chief.
Is Gregory Mason insane? Letting a resident challenge the entire hospital's authority?
Director, the family is very insistent. Also, Chief Mason signed off on it. It is hard to deny it procedurally.
Then, have the chief surgeon review it. Let him decide.
This young man is interesting, Megan. If this patient were yours, the surgery, would you take it?
Based on the evidence, the risks far outweigh the benefits. But, if I had found those inconsistencies, I would.
Have the order prepared. Also, notify general surgery. I'll be observing the surgery myself.
A resident is leading an exploratory surgery to disprove the entire hospital's expert diagnosis. Alex, do you even realize what you are doing?
I am saving a life.
Stanton, you are nothing but trouble. Do you have any idea what this application has done to this hospital? A resident wants to lead an exploratory surgery to disprove the entire staff's diagnosis. Stanton, do you even know what you are doing?
I am saving a life.
Saving a life? You are playing with fire! The director has spoken. If this surgery doesn't go as you expect, it is not just you. Chief Mason too, you'll both be out on your asses.
Since I made this decision myself, I am prepared to face the consequences.
You think that the family's worthless waiver will protect you? Let me tell you, Stanton, in a malpractice case, that paper is worthless. The hospital's reputation, Chief Mason's career. You're just a resident, with no seniority or backing. How can you afford that? You are on your own.
Stanton, you heard that, right? Medical affairs' word is the hospital's word. Give it up. It is useless. Withdraw your application now, and go grovel to Dr. Grant and the director. Maybe your residency evaluation will still pass.
It was my decision. Don't lecture me.
Oh, right. I just talked to my mentor from the capital. He has heard about your heroic deeds, too. He is very impressed with your courage. I'll be there for the surgery. I can't wait for the show.
I'll prove it. I am right.
They're right. This time, we're both staking our careers on that operating table. The chief surgeon has personally approved your surgery.
Chief.
They've all been here, haven't they? They were right. This time, we've both staked our careers on that operating table. Sigh. But that is not all the pressure. The chief surgeon personally approved your surgery, and he'll be your assistant himself.
The chief surgeon, the highest authority in the entire surgical department, assisting me. This isn't an honor. This is a trial. They've turned this operating table into the highest profile execution chamber in the hospital.
You think he is here to help you. He is here to watch you and me and see how this farce ends. Alex, now, do you still dare to do that surgery?
I do.
Go prepare. Tomorrow at 8 a.m. Oregon 7.
This time, there's no turning back.
The chief surgeon is assisting. And it is a hospital-wide live stream.
The pressure is even worse. I feel like I am under the spotlight.
I knew it. You haven't eaten yet.
I am not hungry.
I heard everything. The chief surgeon as your assistant. And a hospital-wide live stream.
The pressure is enormous. I feel like I am under the spotlight, being roasted.
Look at it from another angle. It means someone recognizes your value and is giving you this stage, even with the huge risk. Do you remember what you told me? You said you'd never give up on any chance to save a patient. Now the chance is here. Go. Let all the doubters see a miracle for themselves.
Thanks.
Eat up. It is not good for your stomach. I'll be rooting for you.
Did you hear? The chief approved it. Alex is the lead.
So what if he is the lead? You know who his assistant is? Who? The chief. He is going to be the retractor for that resident himself.
A resident as the lead, the greatest surgeon in the hospital. As his assistant. This isn't just a special case. This is a complete overhaul of Central City Medical Center's 20 years of rules. And there's more. This surgery will be live streamed to the lecture halls in full HD. Live streamed? That is a public execution.
Who knows what the chief is up to? Either he is trying to make Alex a legend overnight, or he is going to make him crash and burn in front of the whole hospital.
Ridiculous. Treating a patient's life like a joke, and our hospital's century-old reputation. It is a joke. Tell everyone in the department to be at the observation session on time tomorrow. I want to see how this resident will end up.
Yes, sir.
A surgery. That is theoretically doomed to fail. It won't just ruin Alex's career. It'll also drag Gregory Mason down with him. Alex, you really think this is a golden opportunity? Number, this is your death sentence. Tomorrow at 8 a.m., there is a live stream of a major surgery in R7. Everyone must be there on time to watch in the lecture hall, to observe.
I wonder how it is going.
Yeah. Gray, this time, you've gone too far. I trust my student.
That is him.
Emily.
The microdissection forceps you asked for. And the 7-0 proline vascular sutures are all ready.
Thanks.
Chief Mason had me prepare this for you, to give you energy before the surgery. I believe in you. You'll prove everyone wrong. And be the star of the show.
Alex, I'll record every single frame of your mistakes and ruin you.
I wonder how today will go.
Yeah.
Gray, this time, you've gone too far. I trust my student.
In the simulation suite, I've run it 97 times. I found the only way to succeed. This time, I will succeed.
Dr. Stanton. Dr. Stanton. Are you ready?
I am ready.
I'll be your assistant today. In the OR, you're in charge. I'll follow your lead, but, Dr. Stanton, if you are wrong, the price will be on you alone.
Don't worry. I won't be wrong.
Alex, one last warning. Once you make that first incision, there is no turning back. You can still back out now.
Chief, I won't be wrong. Scalpel. Assist AI. Activate surgical guidance.
System prompt. Surgical guidance activated. Optimal path planning. Planning complete.
Right here. Alex, I am telling you one last time. Once you make that incision, there is no turning back. You can still stop now.
Chief, I am not wrong.
Stiff, thickened stomach wall, mucosa, rugae gone, grayish-white lesions, like melted wax, covering the stomach, rapidly invading surrounding tissue. This is classic. Borman type hyphae, advanced gastric cancer.
It is over. Textbook linitis plastica, widespread invasion. It is completely inoperable.
Gregory Mason's career is over. What a disgrace.
Director, the facts speak for themselves. This is advanced gastric cancer. This farce is over. Alex, you are finished.
What is he doing? Forcing it!
He's insane! How can you cut linitis plastica? It'll shatter on contact!
This scan is textbook. So textbook. It is hopeless.
Alex, who do you think you are? Challenging the chief. This is what you get. It is over. Lenitis plastica terminal.
Imaging vision. The truth is there.
Alex, it is just like the scan. Admit your mistake now. Do a palliative exploration and close. You'll be humiliated, but at least you'll save your career.
Preparing to resect.
What is he doing? Forcing it!
He is crazy! How do you cut Lenitis plastica? It'll just fall apart!
Insanity! He is committing murder!
Alex, you are asking for it.
Alex, what do you see?
What is he doing? This isn't how you treat stomach cancer!
He is freeing the stomach wall. He is trying to peel that tumor right off the stomach wall.
Number, impossible!
Ultrasonic scalpel. Lower the power. Find dissecting forceps.
He is not using any standard gastric cancer resection. What is he doing?
Stanton, you're gambling with this patient's life.
I'll take full responsibility for everything.
Impossible.
What is he doing? This isn't how you do a gastric cancer resection!
He is dissecting the stomach wall. He is trying to peel that tumor right off the stomach wall.
Number, impossible! That is completely impossible!
Stanton, you are just asking for it. This technique is extremely risky. Stanton, can you really do this?
Look! It is separated. He did it!
What? Impossible.
Dissecting the stomach wall with this precision! I couldn't do this in 20 years!
There is almost no bleeding.
How is that possible? That is completely impossible!
Membrane dissection. Flawless on the stomach. It is a miracle.
Fake! This has to be fake!
Trey. Specimen. Sent for frozen section.
E.
The specimen. This young man's hands are so nimble and precise, like a precision machine. His understanding of the anatomy has surpassed everyone here. Even me.
Chief, let's continue.
Okay.
Damn it. Something's wrong.
The results aren't out yet. Something's wrong. There has to be a problem. Right. The pathology results aren't out yet. What is the point of cutting it out? It proves nothing. It is a parasitic granuloma. Besides, that is a huge wound. It'll only speed up his death. He's just grandstanding. Pathetic.
Look at that.
My God! Dr. Stanton cut the lesion in half!
It is not cancer. It is not grayish white. It is crumbly, like soft tofu.
It is a milky white, granular substance. It is cheesy, necrotic material.
It is a granuloma. A parasitic granuloma. It is all parasite eggs.
Oh, is that possible?
That is impossible. Alex, you did great.
You didn't let me down.
Damn it. Something's wrong.
The results aren't in yet. Something's wrong. There has to be a problem. Right. The pathology results aren't in yet.
Dr. Stanton, intraoperative pathology report. Parasitic granuloma, abundant eosinophils, infiltrating and calcified parasite eggs, no cancer cells, benign.
Alex, you did it. Now, no one will question you again.
Dr. Stanton, looks like you were right.
Quick! To the door!
Hurry, hurry!
How is that possible? How is that possible?
Impossible. Luck! It must be luck. We almost killed a patient with a benign condition.
He actually, in that scar tissue, Completely remove the granuloma.
Incredible. That was absolutely incredible.
He won the bet. Number Alex won. He won so completely, so brilliantly.
Dr. Stanton, well done.
Saline ready to irrigate. Close the abdomen. My scalpel is the truth.
Quick! To the door!
Hurry, hurry, hurry!
Hey! Hey, hey! Dr. Stanton! Number! Dr. Alex Stanton!
That was amazing. Yeah, that is great. It really is. Wow, that was incredible. Yeah.
I propose and will immediately submit to the medical board for approval. As a special talent, we end Dr. Stanton's residency and grant him a permanent position. Alex, you are not just our hospital's lucky star. You're our hospital's rock. That one incision didn't just save a patient. You defended the truth of medicine. You created a miracle for Central City Medical Center. One for the history books. On behalf of the hospital and the board, thank you.
Dr. Stanton, you are a true standout. Your skill, your nerve. Forget being a resident. You could be our chief expert right now. You are more than qualified.
Dr. Stanton, congratulations. You are a force to be reckoned with. This time, I was wrong about you.
Amazing. That is great. Wow. Incredible. Yeah.
I propose and will immediately submit for board approval. As a special talent, we will immediately end Dr. Stanton's residency. He will be given a permanent position in general surgery, with attending level benefits. Congrats to our hospital. We've gained another genius doctor, like Megan Lane.
Mega.
Now, you've got some competition.
Dr. Stanton is a role model for me. About the surgery, I have a lot of questions.
Anytime, Dr. Lei. Feel free to ask.
Then, I'll bother you later.
Alex, this isn't over.
Dr. Stanton.
Dr. Lei.
Your surgery. I watched the whole thing. I have just one question.
Then, have a seat. Sigh, I wonder how the old man's recovery is going. I'll go check on him.
Dr. Stanton.
Dr. Lei.
Your surgery. I watched the whole thing. I have one question.
Sure. Have a seat.
During the laparotomy, when the camera went in, everyone, including the chief surgeon, saw with their own eyes an inoperable linitis plastica. Your parasitic granuloma theory and the reality before you were completely contradictory. In that situation, with the whole hospital watching and legends all around, why did you still dare to make the first cut?
Because they saw cancer. But I saw something else.
Explain.
Linitis plastica is a macroscopic description, not a cytopathological diagnosis. The rigidity from a tumor's unchecked growth and the chronic inflammatory fibrosis caused by a parasitic infection are fundamentally two different things.
So, at that moment, you were 100% certain.
Sure.
Technically, your membrane dissection, especially when you were dealing with the branches of the left gastric artery, there was almost no bleeding. How did you precisely find that natural plane, completely covered by inflammation and fibrosis?
I can't just say I have X-ray vision and a 4K HD map in my head. Can I? It is the feel. My scalpel tells me the safe path, and the dead end.
Using the subtle vibrations from the energy device to distinguish tissue structures that are indistinguishable to the eye, using touch to see microscopic anatomical planes. This is beyond mere technique. Feel. That answer is so unscientific.
The ultrasonic scalpel's tip when it touches tissue of different densities. The high-frequency vibrations it sends back are different.
I see. And then what?
Cancerous infiltration is chaotic. It destroys all structure. So the vibration feedback is noisy, chaotic. But a parasitic granuloma is different. It has its own pseudocapsule. It is a dense fibrous layer the body forms to contain it. Its feedback is firm and regular. My scalpel tells me the path to life and the path to death.
Using the energy device, you can detect the subtle differences in vibration to distinguish tissue structures that are indistinguishable to the naked eye. Using touch to see microscopic level anatomical layers. This is beyond mere technique. It is almost like an instinctive bond with the instrument. A 1 in a million talent. A near miraculous mastery. Central City Medical Center is too small. Among all the brilliant young doctors around me, very few can match me academically. Almost none. But Alex, he is the first to make me feel utterly overwhelmed in my own field of expertise. He is like an ancient book with a worn cover. But when you open it, it is a groundbreaking medical masterpiece. I am humbled. Dr. Stanton, your skills far exceed your seniority. I hope we get the chance to work together.
I hope so too.
Nurse Yates, that move Dr. Stanton pulled. Was he a god?
He is not a god.
Then, what is he?
He is a monster.
Nurse Yates, you were there. The whole hospital's talking about it. They're calling Dr. Stanton the miracle doc. Earlier, I saw Dr. Graham from gastroenterology. He was smoking alone in his office. His face. And Brian Carter. I heard he locked himself in the on-call room. He won't open up for anyone. Nurse Yates, that move by Dr. Stanton. Was he a god in human form?
Ready to excise the lesion. Ultrasonic scalpel.
He is not a god.
Then, what is he?
He is a monster.
I won. Right in front of the whole hospital. I won this insane gamble. Oh. So reckless. Challenging the hospital's official diagnosis. It was like walking a tightrope over a cliff.
Congratulations, operator. Epic mission complete. Overturning the gold standard diagnosis of stomach cancer. Perfect. Subversive. Subversive diagnosis.
This system has other abilities.
Even if the AI had been wrong by a fraction, or if during surgery I'd made the smallest mistake, I would have fallen into the abyss.
Shh. This is a waiver. Dr. Stanton. Chief Mason, please.
But I can't back down. A doctor's duty. Since heaven has given me this gift, I must take on this responsibility. I can't let a single patient who could have been saved die in vain because of a misdiagnosis.
Epic mission. Epic mission. Overturning the gold standard.
This AI has other abilities. Pathology simulation analysis, based on imaging vision. It acquires live microscopic data to build a dynamic pathology model. It can simulate disease progression, drug targets, and surgical outcomes. This feature is outrageously powerful.
I hear a certain hero is hiding in here.
You're here.
Today's surgery was amazing. Now the whole department is talking about the legend of Dr. Stanton. I hear a certain hero is hiding in here.
You're here.
Today's surgery was amazing. Now the whole department is talking about the legend of Dr. Stanton. You know what? The moment you cut into that granuloma, the chief's face. In all my years, that was the first time I'd ever seen him like that.
I just did my job. The surgery today was a success because of you. With all those complex tools, you were fast and precise.
That is just my job.
It is different. Under that pressure, your composure was a huge support for me. Really. Especially when dealing with the left gastric artery branches. I didn't even have to say a word, and you knew what I needed next.
That is only because someone's technique was so unconventional. I had to stay completely focused and follow your lead.
That is why I said, you are the best scrub nurse.
Such flattery. That is not like you, Dr. Stanton.
It is not flattery. It is the truth.
You were amazing today. Awesome. Here's to our monster doctor. Cheers. You were so focused today. It felt like you were a different person.
I just hope. When I face another complex case, a patient everyone has given up on, I can be absolutely confident to say those words to their family.
What words?
I can save him.
I believe. You can. By the way, I heard Dr. Carter is going crazy with jealousy.
Really?
Medicine is science, not a myth. Unless he is hiding something. Stanton! You just wait.
Why him? What makes him so special?
Just over a month ago, he was a rookie who shook just suturing. Medicine is a science, not a myth unless he is hiding something. Alex Stanton, so what if you are a great surgeon? The hospital isn't just about the operating table. Medical protocols, patient records, patient communication. Every single one of these steps is a minefield that can destroy you. Just you wait.
Have you heard? After a 3-year hiatus, the State Junior Surgeon Skills Championship is back.
I bet it is LC again. The most basic, but it is the one with the most pitfalls.
Right. It is not easy.
Dr. Stanton. Here are the last 5 years' key studies on anatomical variations in Callett's triangle. The chief surgeon asked me to give these to you. LC seems simple, but every complication is a painful lesson. This topic. Our team has been stuck on it for 3 years.
Thanks. I'll review them carefully.
The junior surgeon competition is a chance. If you want to use LC, you have to get past me first.
He is getting cocky. He is asking for it.
Hello, Dr. Lane. About standardizing clinical pathways for junior surgeons. I think it is crucial. We've had some new people around lately, and they're acting rather recklessly. Just to get attention, they're ignoring patient safety and medical protocols. I am a bit worried.
Access imaging vision advanced all data. Analyze all LC procedures since the hospital's founding. 3D anatomical models of callus triangle. Generate the imaging models.
Dr. Stanton, here is my analysis of LC procedures, specifically the anatomical variations of Calit's triangle. The standard dissection method is here. But with inflammation or anatomical variations, the risk of bile duct injury is as high as 0.3%. What are your thoughts?
Standard dissection treats the cystic duct and artery as landmarks. But from the start, it is going the wrong way.
What do you mean by wrong?
The cystic duct and artery are landmarks in the fog. Adhesions, inflammation, edema. Any mistake turns those landmarks into traps. One wrong move, and it is a disaster.
So, what is your approach?
Don't find a path. Make one. Treat the gallbladder like an onion. Start from the safest part, the liver bed. Peel it layer by layer, in reverse. When the entire onion is peeled down to just the last connection, the cystic duct and artery will be like the onion's roots, crystal clear. Right in front of you.
Is this a new solution? A method I've never seen before.
Sort of. Imaging vision advanced. All data. Analyze all LC procedures since the hospital's founding. 3D anatomy of Calit's triangle. Imaging models. After 10,000 simulations, the technique I developed, the reverse onion peeling technique, has finally become second nature. I will definitely be able to execute this technique flawlessly.
Did you see the competition notice?
Yeah, I saw it.
Brian Carter competed at the state level last year. He is very familiar with the LC procedure. He'll be your biggest competitor.
Wow, the junior surgeon skills competition. The event, it is really laparoscopic cholecystectomy.
Brian Carter.
He is so amazing.
You saw the competition notice?
Yeah, I saw it.
Brian Carter competed at the state level last year. He is very familiar with the LC procedure. He'll be your biggest competitor.
Knowing the procedure doesn't mean you understand it.
Your reverse onion peeling technique. How is the preparation going?
This time, I am going to blow everyone away.
Hey, did you hear? Alex Stanton signed up for the junior surgeon skills competition.
Him! Competing in the LC. He can't even hold the scope steady. Laparoscopic surgery is all about real skill. One wrong move, and you lose a life. He is just asking to be humiliated.
Brian's mentor is the city's LC authority. The title is yours for the taking.
Alex Stanton is just a clown. He is just a stepping stone for you.
I don't get what the chief is thinking. Who does Alex Stanton think he is, thinking he can improve the gold standard?
And now he is even joining the competition. He is just making our department look like a joke.
He is too cocky. He'll crash and burn.
I heard the deputy chief isn't happy about this. At the meeting, we'll find out for sure.
Nurse Yates. Vice Director Grant and Chief Mason are betting on Dr. Stanton. They bet in front of the whole department. For a car wash.
Alex, I believe you are going to win this competition.
I'd like to take this opportunity to say a few words. Medicine is built on experience. There is no room for showboating or shortcuts.
Dr. Grant, you are implying something. Just say it.
A resident who just finished training who doesn't even know the clinical protocols is representing our department in the competition. This kind of desperate ambition should not be encouraged.
Sometimes, talent matters more than 10 years of experience.
Bullshit talent. Surgeons are craftsmen. Without thousands of surgeries under your belt, you are gambling with a patient's life. It is a joke.
Fine. How about we make a bet? If Alex wins the championship, I get nothing. But if Alex loses, I'll wash your car for a month. And I'll do it in front of the whole hospital. You in?
Deal. If he makes it to the finals, that beat-up body of yours, I'll make it shine like a mirror.
Nurse Yates. Vice Director Grant and Chief Mason are betting on Dr. Stanton. They bet in front of the whole department. About washing a car.
Alex, I believe you will win this competition.
This is the head judge. From the State First Medical Center, Deputy Chief of Hepatobiliary Surgery, Dr. William Turner. I analyzed his papers from the last 5 years and his surgical videos. His style is extremely conservative. He insists on 100% safety margins. He treats clear anatomical planes as sacred. Your onion theory is the biggest risk in his eyes. You are challenging his medical beliefs.
I believe in my method. I can make him see my way.
I've seen Union Med PhDs, Northbridge geniuses, but they're still bound by the rules. You are different. So don't lose over something like this. The chief wants you. Go straight to his office.
Okay.
Do you know why the state asked Dr. William Turner to be a judge? For you.
Emily, you are an amazing cook. So good. Chief.
Do you know why the state asked Dr. William Turner to be a judge? For you. Your stomach surgery video has reached the state. Some say we just got lucky. Others say we're just grandstanding.
The truth will prove everything.
This competition is a test from the state. A test of our mettle. Dr. William Turner is here to assess if you are the real deal. This competition isn't about you. It is about me, about Dr. Gregory Mason, and about the entire Central City Medical Center. You have to win. Win so they have no choice but to respect you. And leave them speechless.
Don't worry. I'll give it my all. This time, I'll show everyone that medicine's boundaries shouldn't be defined.
I heard from the staff. You haven't eaten all day.
I am preparing for the junior medical competition. I just forgot.
You have to eat, even when busy. You need to be healthy to treat more patients. Try some. I made it myself. See if you like it.
Emily, thank you.
Slow down. No one's rushing you.
Emily, you are an amazing cook. It is delicious.
Wait.
For the Junior Surgeon Skills competition, the event is laparoscopic cholecystectomy. The competition uses a high-precision simulation system. For this Junior Surgeon Skills competition, the procedure is laparoscopic cholecystectomy. The competition uses a high-precision simulation system, scoring criteria, time taken, anatomical clarity, blood loss, and technical precision.
The judging is strict this time.
Yeah, this is about skill, not luck.
This time, some people might not make it.
Now, let's welcome our first competitor.
Alex, this time, I'll show you the real gap between us.
Procedure starts.
His movements are fast and steady. Every dissection is precisely on the anatomical plane. Not a millimeter off, not a single one.
Pneumoperitoneum.
Trocar insertion. So fluid. Like a precision instrument. Incredible.
Callus triangle. Standard dissection method. The gold standard. And the most authoritative. For now, a test of a surgeon's fundamentals.
His movements are fast and steady. Every single dissection is precisely on the anatomical plane. Not a millimeter more, not a millimeter less.
His hands are steady as a robotic arm.
Dr. Carter's technique doesn't even look like surgery. It is just showing off. Look at this.
Cystic duct. Cystic artery. Perfectly exposed. Impressive. Standard and safe.
The whole procedure was seamless. Zero bleeding. Incredible.
Procedure complete.
Dr. Carter's time is 12 minutes, 35 seconds.
Greg, time to wash my car.
Just wait for Alex. You won't even get to touch the wheel. Dr. Carter's technique is textbook. Solid fundamentals. Clear anatomy. Flawless. In surgery, safety always comes first. We must never be showy or take reckless risks. No recklessness, no showboating. Within the established framework, strive for perfection. That is the direction young surgeons should pursue.
Your luck has run out.
Dr. Carter has just delivered a truly spectacular performance. The next competitor has their work cut out for them. Now, let's welcome our second competitor, Alex Stanton.
What is he doing? Is he frozen?
He is too scared to even start.
A surgeon's worst enemy is hesitation. That is analysis. Paralysis. It means he has no plan.
What is he doing? He is frozen.
He is too scared to even start.
Greg, so this is your so-called natural talent. He can't handle the pressure.
A surgeon's worst enemy is hesitation.
That is analysis paralysis. It means he has no plan. All flash, no substance. He is exposed the moment he starts.
Shut up.
My goal isn't to be faster. It is to be absolutely safe and to completely outclass them.
What is he doing?
Wrong approach. This isn't the standard method.
Did he mistake the liver's upper edge for Callot's triangle?
Dr. Stanton's approach is unconventional. It is even wrong. With the gallbladder anatomy unclear, dissecting from below is extremely dangerous.
He got the basic approach wrong. I overestimated him. The competition is over.
See, Greg, this is what you get for being so desperate. In a bit, I'll personally teach you how to use imported palm wax.
Reverse onion peeling technique. Can he really do that?
Is that membrane dissection? My God, he is not just operating, he is rewriting the rules.
His hands are terrifyingly steady. The ultrasonic scalpel is always between the gallbladder and the liver bed. That natural gap, thin as a cicada's wing. Every activation, the energy is just right.
The dissection site is almost completely bloodless.
So steady.
Wait, he has not lost Callus Triangle.
He is deliberately avoiding it.
Reverse dissection. The gallbladder body has been completely freed from the liver bed. He is creating a brand new, never before seen, absolutely safe anatomical plane.
This is membrane dissection!
The boundary between the gallbladder and liver is as sharp as a ruler's edge. Even a textbook can't capture this absolute clarity.
In the liver bed, the most bleeding-prone area, he achieved a perfect dissection with almost zero bleeding. How is that possible?
What am I seeing? The Bermuda Zone, the bane of so many surgeons, is now revealed with absolute clarity.
The cystic duct and artery, both vessels, so clear, so distinct.
My God! He is not just operating, he is setting the rules!
Procedure complete.
5 minutes over. So, does he win?
I don't know. I am just in awe.
I am screwed. I have to wash Gregory Mason's car. That bastard.
Wash my car. You think you are worthy. Procedure complete.
"5 minutes over. Does that count as a win?"
I don't know. I am just in awe.
Colleagues, what we witnessed today was more than just a competition. It was the birth of a new surgical philosophy. Dr. Stanton demonstrated something more valuable than speed. Certainty. He sacrificed 5 minutes for 100% safety. He used reverse thinking to fundamentally avoid all anatomical pitfalls.
This is the future of laparoscopic cholecystectomy.
I chased speed. He chased precision.
Thomas Wood.
Dr. Stanton, what is the name of this technique? I'll copy the video and promote it statewide.
I call it the reverse onion peeling technique.
I declare the champion is... Dr. Carter's performance was flawless. He was fast and precise.
Today, we all witnessed a miracle.
I declare the winner of today's competition is Dr. Alex Stanton. Dr. Carter's technique was nearly perfect. He was fast. His technique was precise. He is a masterful craftsman. He was very fast, but his clamp was less than 0.5 millimeters from the common bile duct, a potentially fatal risk. But Dr. Stanton demonstrated a mindset beyond the craftsman, a master's mindset. He sacrificed speed for absolute safety. This is a victory of philosophy, a complete dimensional victory.
Well, Louis, your M9, I won't be driving it tonight. As for my old Audi, you'll have to keep dreaming.
Today, we have all witnessed a miracle. Dr. Stanton's innovation is a great contribution to our hospital and the state's hepatobiliary surgery. I therefore propose and declare that this technique be officially named the Stanton Exposure Technique. From this day forward, the Stanton Exposure Technique will be adopted as the standard protocol and fully implemented. Having a technique named after you is a surgeon's lifetime, unattainable, and highest honor. It is a place in history.
Alex, you are just too good.
Here, this is for you.
A reward for the champion.
A little reward for the champion.
Alex, you are just too good. You forced me to forge the records. Not my fault. You are done for.
You're here.
So, someone won the championship. And I can't come to congratulate them.
Of course. You can.
Your performance was flawless. Here, this is for you.
Is this a reward for the champion?
It is a little reward for the champion.
So sweet.
This one's for you, too.
Is this a reward from the champion?
You should get some rest. I have to get going.
My time has only just begun.
Attention everyone! Effective immediately! Dr. Alex Stanton is being promoted to attending physician.
Brian Carter, you are under suspicion of false accusation. You are under arrest.
After a decision by the hospital board, and with special approval from the health authority, effective immediately. Dr. Alex Stanton is being promoted to attending physician.
First year resident? Straight to attending.
Also, in recognition of Dr. Stanton's groundbreaking contributions to hepatobiliary surgery, the hospital will immediately begin the special evaluation process for his deputy chief title.
Deputy chief, I've worked for years and never dared to dream of it. He did it in just one surgery.
Quiet, please. While we celebrate this joy, our hospital must also face a problem and purge a toxin. The essence of medicine is truth. Uphold the truth, defend the truth. Yet among us, someone for their own selfish gain maliciously trampled on this principle.
It can't be about the forged records. They found out.
Dr. Carter, please come up. Come up. After an investigation by our disciplinary department and the medical affairs office, and verified by the police, it has been confirmed that resident Brian Carter, along with his mentor, to sabotage Dr. Stanton, conspire to forge surgical records, distorted the truth, fabricated charges, and maliciously framed him. They are suspected of malicious prosecution.
Slander! This is slander! It was Stanton! You are all in on this to free me!
After an emergency board meeting, all evidence will be handed over to the authorities to pursue legal action.
Brian Carter, you are suspected of malicious prosecution. You are under arrest.
Stanton! It was Stanton! Aftershocks continue. High pandemic risk.
It is a crisis on all fronts.
If something happens to you, over there, it'll all be for nothing.
Chief Surgeon! Dr. Stanton!
I just got a call from the National Health Emergency Office. It is an emergency. Our neighboring country has been hit by a massive 8.0 magnitude earthquake. The situation is dire. There are massive casualties. The medical system is nearly crippled. The government has decided to organize our top emergency medical team to go. The official on the call specifically emphasized that they need an expert in pancreatic cancer research and complex hepatobiliary surgery with outstanding contributions and with interdisciplinary emergency response capabilities. Dr. Stanton, as the core expert of the surgical team, you must report to the capital immediately. Alex, have you thought this through? This is no ordinary mission. Aftershocks are constant. High risk of disease. It is full of dangers.
He is right. Alex, your career is just taking off. If something happens to you over there, it'll all be gone.
I am a doctor, right now. My country needs me most. And the victims need expert care. It is my duty. Please approve. I'll leave at once. I won't back down.
Good. National duty comes first.
The hospital fully supports you.
Alex. I heard you are leaving soon. You have to take care of yourself. Come back safe. I'll wait. To train me when you get back.
Dr. Stanton, I just saw the international news. The situation there is dire. Severe landslides at the epicenter. Roads are completely blocked. Communications are mostly down, and aftershocks are frequent. The local medical infrastructure is almost destroyed. Even basic water and power are an issue.
I understand.
You must stay safe. I know. Time is tight and the mission is tough. I won't keep you. You have to come back safe.
Alex. I heard you are leaving soon. You have to take care of yourself. Come back safe. I'll wait to train me when you get back. Time is tight. I didn't have time to get anything else. When you miss me, have one.
Oh, thank you.
Promise me. You have to come back safe. I'll wait.
Don't worry. I will.